Again, I want to talk about the gingival effect, the pink aesthetic results that we're looking for. And classically, when you're going to do that, you need to think about interdisciplinary therapy. Interdisciplinary dentistry is really what you need to be thinking about here. So can this just all be handled from the restorative aspect? And everyone in the room knows no. Can it be handled just from a surgical aspect? No. And many times we forget about actually one of the most important parts of this team, this collaboration really, which is our ceramist. You know, I love the title. I love your theme of this meeting when you're talking about classic principles and cutting-edge techniques, all right? You know, what are we trying to do in aesthetic dentistry? We're really trying to emulate nature. That's really what we're trying to do. We're trying to emulate the beautiful tooth structure, the wonderful God-given tooth structure of enamel and dentin, and the way these two intermix from both a biologic, function, and aesthetic standpoint. Right? And so, again, looking back at your theme for this meeting, when we talk about classic, I love when you look up the word classic, though, the first or highest quality class to rank. And certainly, I think that's what the AAID and I think the AACD really stand for those, which is high quality class acts, really. And then when you look at cutting edge, position of greatest advancement of some field. And certainly I think these two academies have done so much for the advancement of knowledge, which this knowledge, so many times we forget about it. The knowledge at the end of the day benefits our patients, which is who we're here to serve. And I think sometimes we forget that, but that's who we're here to serve, as we all know. Hopefully, I'll share something with you today, a couple pearls. My objective as an educator is always to share just a couple pearls, if I can, that you'll go back and integrate into your practices, and maybe come up with a better outcome. That's really what we're all looking for. So a harmonic balance. Are we looking for symmetry in our dentistry? And I think everyone here knows, no, we're not looking for symmetry. We're looking for some type of harmonic balance between form and color. To create individual smiles, though, to create individual smiles. How many times have you seen work that comes out of a dentist's office or a lab's facility, if you will, that all look very, very similar, and that's really not what we should be doing in aesthetic dentistry, I don't believe. Right? And just a couple of my patients, just having a little bit of fun. I'd like to take portraits of them when we're done, and then seeing them a little bit in living color. That's my office, my email address right here. If you would like to contact me, Brian at cosmetic-dentistry.com. I practice, as I said, in Beverly Hills. I've been there for 25 years, started out at the University of Maryland. That's where I was trained as a general. I'm a general practitioner. I do not place implants. I restore implants. Is really my angle. I work with some very good oral surgeons and periodontists in my community. But I know many of you in the room as general dentists, general practitioners, place your implants, and I say, great, why not? We should be doing it, absolutely. And so this collaboration, though, this collaboration we're talking about, does everyone see things the same? Does everyone see things the same? The eyes can't see what the mind doesn't know. One of my favorite sayings, really, is the eyes can't see what the mind doesn't know. Hopefully, maybe I'll open up your eyes just a little bit into some pink aesthetics, the pink aesthetics world. And so there's certainly the collaboration and communication that needs to occur between the clinicians, whoever's part of your team, the laboratory technician, or technicians, and certainly the patient. And for me, it comes down to much about a diagnostic phase in these treatments, and then coming down to prototypes. For me, prototypes are so crucial. I'm going to show you how I make prototypes, what I do with prototypes, and how long. You're going to see some of the dates on these cases, because my cases probably take a little longer than some of you in the room, as I just try to push tissue and get it exactly like I want. And so we need to talk about, what is that exact? What are we talking about? So let's just start off by just looking at just a couple cases, just some before and afters, and look at what makes them nice cases, but also what makes them slightly less than ideal. So what are some of the issues there? And I'm not going to point those out, because you can see those with your own eyes. There's no question. There certainly are defects. There are defects in every case that I've ever done. I'll share that with you. Probably you feel the same way. What are we trying to do every day? We're trying to emulate nature. That's really what we're trying to do, is emulate nature. And so, you know, What have I done well here in the single anterior implant restoration? And what are the things that we could improve on? And that's one of the things the AAID does well with their fault system for accreditation. And so, well, I'll mention a couple of the faults as we look at some of the cases in depth. I have 4 or 5 cases that we're going to look at in depth. And just kind of a quick overview. Again, what tooth is the implant here? Which teeth have been restored? Which teeth are natural dentitions? Kind of maybe sort of hard to tell. Most of you can probably figure out which one is the implant. We'll probably get to Scott in the program. Hopefully there's Scott. He thinks he's a good-looking man. Okay, he's okay. He's okay looking. You know? And this is a challenging case. How many times we've seen Dr. Lee earlier and the gentleman before me talk about, you know, the high lip line. And she's not even smiling full smile, and so she's got great exposure, and she certainly has had a little bit of defect here. You know, she's had about 5 surgeries. This case is about 10 plus years old. It would probably be done very differently today, but this gal went through about 5 procedures, surgical procedures, before she ended up in my office wondering what I was going to be able to do for her. But look at the huge defect here, you know, exposed abutment and such, and you know, what can we do? And as the implant science has evolved, everyone in the room would handle this case slightly differently today, but this is a challenging case for us. And so this involves certainly me placing in some pink porcelain, which really we saw some nice cases earlier this afternoon. So you can always see a slight demarcation. Certainly in the retracted view, you can see a demarcation. But in the smile view and the full face view, really, when we're looking at social distance, really, at social distances, then do these restorations blend in with the natural dentition? Did I handle the pink aesthetics well? And equally as important, did I handle the white aesthetics well? That's really what we're trying to do here.